specialized type setting could be applied in medicine. And then the next step is really taking it to the patients and the physicians to really integrate the healthcare, as Peter talked about.
So one of the major challenges with developing software for wearables is rest in the user interface. The limited screen size requires careful consideration of how the information is presented and acted upon. In your opinion, what are some key considerations when developing an effective wearable user experience in enterprise?
I would say it starts with choosing the right data and knowing how to choose that data contextually. And that begs the question about the interface of how you get that data. Is it gesture-based? Is it voice-based? So that you can pull up the right data at the right time. And those are questions that the software solution providers are asking the clients all the time. What's the right data and how is it to be displayed, and how do you interact with that data in order to provide it to you quickly in surgery or on the offshore platform?
Yeah, ditto.
Yeah, I think that probably the most important thing with software is it's got to be simple. It's got to be simple and easy to use. Like, I'm a doctor, but I've got thousands of IT people behind me, and when I wanted to use Glass, they freaked out. They lost it. They were like, oh my God, we're going to have to put in new systems, we're going to have to put a new backbone and all that. And I said, hey, look, I'm working with this company, Pristine. It's a web browser and Glass. That's it. And simplicity is really kind of what really buys you kind of the foot in medicine. In addition, it's when you're deploying these things, you're giving them to your colleagues, I'm giving them to my fellow physicians, and the cool part about these smart glasses and augmented reality, especially with Glass, is that it's simple, it's intuitive, and it's easy to use. So those pieces with a very simple software architecture that you don't need much maintenance in really goes a long way.
In our company, our motto is visualize what matters. And what matters for the surgeon, what matters for the mechanic, what matters for the inspector, is what the solution providers need to help with. So one of the things that we've developed is a beacon technology that sits on heavy equipment. So when you walk up to that equipment, it pulls up only the information associated with that, as well as sending things like pressure and temperature and other things to the glasses controlled by the cloud. That aspect is very important to visualize what really matters and to get to the data appropriately. Thank you.
So here's one of the reasons. So augmented reality, with wearable devices like Meta 2 and Microsoft HoloLens they have potential to reshape the user experience when you go to physical and digital world. Having sensitive experience when you go to VR and AR solutions, what do you see as key areas for mixed reality to truly be successful in enterprise?
So I think sort of big picture mixed reality is fascinating in medicine in that I think the ultimate goal that I can see is a sort of surgical dashboard or a physician's dashboard that has exactly what we've talked about, data that I want, when I want it, and it's the right thing. I need Mrs. So-and-so's MRI because I'm looking at her. At some point we bring in overlays to do essentially Google Maps of the body live so that we're not cutting into the wrong thing. There's a lot of factors we deal with in the operating room that these things can develop into. But I think that's sort of this mixed AR, VR, surgical roadmap, anatomy positioning system that we're going for. I think we're really far off. I think today telementoring would be pretty good if we can get that down.
Yeah, I think to echo Paul, I mean, in the ER, you've got a chaotic scene where you have people in the hallway and all that. You need something super simple. Originally our hospital's like, well, why don't you take this cart and roll it through the halls? I mean, it's too much work to log in and you get this big device to work in a hospital setting. And here you can put on a pair of glasses. You transform yourself into a telemedicine suite wherever you are. So I think it's the simplicity, it's the use of AR to pull data into you, but also the ability to use these wearables to push data out, important data out to other people remotely.
We were at the Johnson Space Center in Houston last week, just down the road, talking to the trainers who train the astronauts at the space station. And I mentioned something which is another one of our mantras, train as you work, work as you train. And immediately the head of training said, train as you fly as you train. For 30 years we've been saying that. I think virtual reality and augmented reality come together in that training operational environment where you could use, in the future, use smart glasses and do training on smart glasses. And there's a tremendous opportunity to serve up the same information from a training perspective as well as from an operational perspective. I was talking to one of the super majors the other day in oil and gas, and they say that the worst thing that they can do as an offshore worker is to go onshore to spend a week in the classroom where they check the box, they go back onshore for another 2 years, and they continue their work. If you could do some of that refresher training offshore, for instance, where you're working with your smart glasses, you're visualizing what matters in the field, data, documents, and then in your downtime, use the same set of glasses for a type of heads-up display for virtual reality, although not quite as immersive, we could save a lot of money. And really, we're seeing between 10 and 15 times retention rates using virtual reality over lecture-based learning. That's the data we're collecting today.
Yeah, I think in healthcare, that's a big line of how we get adaptation to this. We need to start training our residents using these systems and preventing injuries before they happen through these types of systems. We really haven't done that. We've started to do that, but we really haven't taken that to the next level. The only thing I'd echo in all of this is really, it's not only also the user interface, it's about a need. And I think is anybody familiar with the app Hippocrates? You guys heard of that? Nobody's heard of that? Oh, good. It's a new story for you then. So Hippocrates was one of the first apps that ever came out for basically the Palm 3. So I was the cool guy or the dork when I started medical school, whichever way you wanted to call it, who had a Palm 3. Well, all my classmates were dragging around these, little pocket PDRs, all the drugs. There's 1,000 drugs. I can't remember. Every day you get pimped on rounds. What's the dose of that drug? What's the dose of that drug? Well, this Hippocrates was a simple, basic search bar, almost like Google, and you could just put in the name of the drug, it would pull up the name of the drug, and it would allow us to have the doses. So I looked like the super stud on rounds, and then that took off. But people don't realize nobody really cared about the calendar on there, the scheduling, all that stuff, because we had our attendings had secretaries on there that did that. What they cared about was that app, and that app essentially drove Palm Pilot and what we have today into medicine to some degree. It really did, because it filled the need of the students and then the doctors because of a growing PDR that was this thick and weighed 30 pounds that we had to look through. So I think that's what I would use that sort of model if you're going to go into healthcare. Healthcare is a different animal, as you all know. I think a lot of people have avoided it for privacy reasons, other reasons that we're probably going to get into a little bit. But I would really think about that need. What's the need? And I would start at a level of medical student residency, because this is about a cultural shift. Everything in medicine is a cultural shift. And so to get that, you're going to be a decade from now to get what we want to do today to some degree to get it adopted into medicine.
So you touched a little bit of having the right data available to users. So wearables and IoT devices are already generating vast amounts of data. Creating too much data for the user means that with enterprise applications makes sense. In your opinion, what are some key development areas that bring enterprise wearable applications to the next level?
We need to get really good at data analytics. So I'll give you an example. We deploy these wristbands in some patients who abuse cocaine to find out when they're craving drugs so we can prevent them from using. These things, we sent them out for a week. We got about 6 billion data points per patient. We have 30 patients. And the question is, how do you analyze all that data? And so it's really kind of learning techniques for big data, learning natural language processing. I think all these things need to come together, especially in healthcare, for us to really start to make sense of, all the numbers that we're getting, all the biometrics that we're getting from all these people. What does it truly mean? How do you cone in and annotate the data? So how do you get your workers or your people to annotate data of kind of important parts in their process that we want to kind of hone in on? I think those are all kind of the really important pieces of the big data part.
The opposite is true of oil and gas. There's a lot of data already, but it's not good data. It's not kept up to date. The PNIDs and other types of information is not updated in the field from a construction perspective. So I think in our industry, it's more around the discipline for the industry to get better data to start